Hi, what if I told you that there was a single treatment capable of prolonging life, enhancing memory, and boosting cognitive abilities? Some of the most common side effects include feeling less anxious and more energetic. It can also lower the risk of cancer, heart failure, and diabetes. Seems both astounding and dubious. However, to justify these claims, there are close to 18,000 thoroughly validated scientific articles to date, demonstrating that the origin of these miraculous results, rather than a wonder drug or elixir, is simply an 8-hour night of sleep. My name is Martín Esparza, and my bachelor thesis is about automatic classification, quality analysis, and enhancement of sleep. Neuroscience has not only revealed the aforementioned properties of shut-eye, but has also uncovered the severe repercussions that sleep disorders imply. Evidence in favor of the clinical relevance of a good night's sleep seems to have had the opposite effect on society. We unknowingly alter one of the most important physiological processes without fully understanding the wide spectrum of consequences sleep deprivation and sleep disorders can have. Insomnia, narcolepsy, REM behavior disorders, periodic leg movement, obstructive sleep apnea, bruxism, and several other pathologies serve as examples of the vast extent of sleep disorders. All of these have one thing in common. Their diagnosis passes through a polysomnography test, a method where the patient spends a full night at the sleep unit of a hospital and their brain activity, eye movement, EKG, EMG, and airflow, amongst others, are monitored. This montage of over 15 cables and other sensors hinders normal rest and is especially harsh on children, elderly, and obese patients. On top of this, neurophysiologists are forced to analyze hours and hours of data for each patient simply to classify sleep as wake, REM, or non-REM. Furthermore, they have to interpret the large amount of data and conclude in a diagnosis for each patient, which on the long run can decrease their performance. Although automatic detectors exist, their clinical acceptability is low since they fall short of the 80% inner rater accuracy in the staging process. The objective of BitBrain and myself is to create a device capable of automatic staging, quality analysis, and enhancement of sleep, with expert-level scores. For this, a convolutional neural network is employed that takes as an input the single-channel information of BitBrain's EEG system. After that, the network is capable of classifying the signal into 5 different classes: wake, REM, and the 3 subtypes of non-REM sleep. Once automatic classification is achieved, the device uses the labels produced by the algorithm and the signal itself to compute a series of quality metrics and patient-specific report. The purpose of the device is to allow patients to perform a screening test for sleep pathologies at their home, this way alleviating the burden on the healthcare system by avoiding unnecessary tests.